Thank you for this kind introduction, and hello everyone, and welcome to the Geron Technology Innovations Expo and Virtual Summit. My name is Majd Alwan. I'm the Senior Vice President of Technology and Business Strategy at LeadingAge in the United States, and I'm the Executive Director of the LeadingAge Center for Aging Services Technologies, and it's a great pleasure and honor for me today to be the keynote speaker of this esteemed summit. And today I'm going to be talking to you about how LeadingAge and CAST are supporting aging service providers in the US in their journey to adopt and embrace technology. So for those of you who are not familiar with LeadingAge, LeadingAge is a 501c3 not-for-profit that has under its umbrella over 5,000 aging service providers, providing services across the whole spectrum of care, from skilled nursing facilities all the way to home and community-based services. And we have members in 43 states. Our members collectively serve over 4 million older adults and caregivers on a daily basis. And CAST is a unique program that brings technology developers and innovators, like some of the ones you have in your expo, together with forward-thinking aging service providers who are among the audience today, as well as academicians and researchers. And in fact, I came to LeadingAge from the University of Virginia almost 15 years ago, where I was doing technology development back then. So CAST's mission is to accelerate the process of development, validation, evaluation, and ultimately the adoption and embracement of appropriate technologies that can improve the quality of care and quality of life for the older adults, and potentially improve efficiencies, reduce caregiver burdens, and ultimately potentially reducing cost to society. So early on, we started with raising awareness to the potential of technology and available technology solutions. We quickly found out that our members and aging service providers in general needed to see something, to see a vision. So back in 2005, we created a video for the White House Conference on Aging, painting how technology could revolutionize the delivery of aging services. And that was a very powerful video, but it was created using computer graphics, CGI, because many of the concepts depicted in the video were actually still on the drawing boards by developers. But we created another version of this video back in 2012 after the passage of health reform. And in that one, that I would highly encourage you to take a look at your own leisure, we have used technologies that were commercially available on the market, and some of those have evolved significantly since then as well. Around the same time, we developed technology spending as well as technology adoption surveys to help us gauge the types of technologies and the rate of adoption of these technologies, as well as the amount of investments in different technologies and different technology categories. And I'm turning my video off here so that you can better see my graphics. So as I said, the technology spending, we do that with chief financial officers. We conduct that every 2 years, and we usually ask them about the technologies that they've invested in over the past 12 months, what technologies they're planning to invest in over the next 12 months. And also we ask about the percentage of technology spending out of their capital as well as operational budgets. And here you have the results from the 2020 survey, which clearly shows significant interest in video conferencing capabilities, in upgrading and updating the infrastructure to handle the sudden increase in demand on bandwidth created by video conferencing and virtual education and teleworking and so on and so forth. Interest in enhancing access to the internet and social networking sites for the residents and the clients to improve or combat the social isolation created by the lockdown and the as a result of COVID-19. And also we added a new category focusing on infection control systems, again, as a result of the COVID-19 pandemic. Our technology adoption survey, we deploy to our largest members. We started with the first with the largest 100 members in between 2013 and 2014. In 2015, we moved to the largest 150 members, and in 2017, we have actually started deploying this survey to the largest 200 members of LeadingAge, which represent roughly like 70% of the 5,000 individual communities or operations and sites. So again, if you factor the fact that we're adding 50 new sort of smaller organizations at each one of the transition points here, that explains the drop that we see here between 2016 and 2017. And we can see that the adoption of electronic health records and technology in general, as well as electronic point of care, is on the rise. And a majority of our members have these technologies in place today. It's worth noting that also this year we have seen a significant jump of 11% compared to last year in the adoption of social connectedness and resident engagement, again, as I mentioned, as a result of the pandemic. Also, at the end of 2019, we added a new category of technologies that includes advanced analytic tools that are capable of pulling data from multiple software packages and multiple IT systems to provide a more meaningful visualization dashboards and data analytics and insights to our members. Also, through the technology adoption survey, we're measuring the percentage of our largest members who are participating in exchanging health information with external care partners like hospitals and physician groups that are not part of their corporate structure, whether that's directly through a one-to-one connection between their respective EHRs, or as a one-to-many connection through mediation of health information exchange networks or health information exchange entities, whether it's regional, state, or national. And as you can see, 51%, a slight majority of our members, are actively participating in health information exchange. A few years after starting to measure the adoption of electronic health records, we became interested in better understanding the level of sophistication of EHRs that are being deployed by our members. So back in 2016, we partnered with Point-Click Care, one of the major EHR vendors in the US that's active in the long-term and post-acute care space. And I believe they're available internationally as well. And we adapted the HIMSS, the Health Information Management Systems Society, 7-stage EHR adoption model, which was originally created for acute care sector, hospitals and physician clinics. And we adapted that model for long-term post-acute care settings, all of the long-term post-acute care settings. And essentially, the 7-stage model that we now have includes the first 3 stages are quite basic in my opinion, and we only start becoming having an advanced EHR at stages 4 and higher. So in stage 4, we have systems that have clinical decision support systems, for example, that can be used to improve the quality of care internally. When we start integrating with ancillary services externally, like integrating information from the pharmacy IT systems, lab results, as well as potentially radiology, if relevant. In stage 6, when we have basic information exchange capabilities like Project Direct in the US, where they can use secure email to send clinical care document or CCD documents, or engaging portals for the patient or resident to get their personal health information and access it, or for engaging the physician remotely in terms of signing remotely, e-signature, electronic prescribing, or electronic order. And again, stage 7 is the holy grail of interoperability and health information exchange. As I mentioned, that's when there is a full record exchange capability, either directly between two entities, EHRs, one-on-one or one-to-one, or through health information exchange entities as one-to-many or electronic health record registries. After developing this model, we started asking the EHR vendors that are active in the long-term and post-acute care space to identify the percentage of their clientele based on this model and the functionalities and the modules that they have deployed. And over the past 5 years, as you can see, we are seeing significant reduction in the percentage of providers belonging to stages 1 and 2, the basic EHRs. And we're starting to see significant increase in the percentage of providers who have deployed functionalities belonging to stages 6 and 7. So generally speaking, we are heading in the right direction, and we are very pleased to see that the EHRs are getting more and more sophisticated. Another important aspect of technology that we're raising awareness to is the fact that our demand on bandwidth is increasing year over year. So I don't know if you're familiar with Nielsen's law. Nielsen has been observing users of the internet's demand on bandwidth, and he's been seeing a 50% increase in demand on bandwidth among high-end users of the internet year over year. So don't let this straight line fool you. This is a logarithmic scale. So, and in fact, this is an exponential growth. And I firmly believe that, especially due to the COVID-19 pandemic and the whole world sort of clamoring for video conferencing services and so on and so forth, virtual learning like we're doing today, and telecommuting and teleworking, the 50% increase is probably going to be more moving forward. Again, due to the evolution of technology and more higher resolution cameras, higher definition videos, and so on and so forth, in addition to the step increase that we've seen as a result of the pandemic in terms of the use of the bandwidth on the internet. So we're raising awareness that our members need to future-proof their investment in the information and communication infrastructure of their organizations and operations, and they need to better understand their current bandwidth needs. They need to estimate or evaluate the annual growth in terms of demand on bandwidth. and determine how many years they expect this new infrastructure or the upgraded infrastructure to live for, then calculate the future or estimate the future bandwidth needs. So again, if a provider has a 1 gigabit per second speed requirements today, they're seeing 60% year-over-year increase in demand on bandwidth, and let's assume that they're upgrading their infrastructure and expected to live for the next 10 years. They're not going to need 10 gigabits per second in 10 years. They're going to need actually 110 gigabits per second. So again, we're emphasizing the importance of future-proofing their ICT infrastructure. Of course, we cannot talk about technology and aging services in 2021 without mentioning the potential reciprocal impact that COVID-19 had on technology and the impact that technology has had on society as a result of COVID-19. As we've all seen, COVID-19 drove the adoption and use of technology in a variety of applications ranging from social connectedness to remote work to telehealth to infection control. Right? It has shown us, COVID-19 has shown us the value of technology and again, ranging from necessity, sort of overcoming lockdowns and using social technology for social connectedness, to sort of mitigating the or managing the spread of the virus and using telehealth, for example, to access healthcare services safely and conveniently. To delivery of groceries and so on and so forth. And I personally firmly believe that without technology, the impact of COVID-19 on our society and on the world's economy, especially the aging services sector and the older adult population that we serve, could have been far worse. The other thing that we see is that COVID-19 has accentuated the workforce shortage and crisis in the US in particular, but I believe generally the rest of the world. A lot of people now decided that they want to find a safer sector to work. They want to work from the convenience of their own homes, which is not always sort of doable for all jobs in aging services. And in fact, it's pushing a lot of aging service providers to think more seriously and explore technology solutions for automation, for sort of redesigning their workflows, for sort of redefining jobs and identifying roles that could be done by technology and potentially, for example, replacing a human with a robot. Even though this was of interest sort of for a long time, but it has always been done on a pilot, small scale, but people are now thinking about these aspects and thinking about integrating robotics operationally. I firmly believe that the pandemic made technology a mainstay and a basic right. For example, the right to access health. And again, sort of social connectedness, and it has made broadband, which is key, right, to any technology, as a human right and as a utility that should be available anywhere and everywhere, just like water and electricity, right? I firmly believe it may have changed people's mind, companies' minds about telework, about telelearning and acceptance of these things. And as we have all seen, it has significantly reduced business travel. I don't know about leisure travel, but I think that's a different story there. But that's generally the impact that we've seen. To sum up, the hallmark of the era that we're living in right now is sort of highlighted here. We're seeing exponential growth in demand on bandwidth. We're seeing explosion of data, which highlights the need for better ways to visualize, contextualize, mine, and use the data to derive insights and to inform decision-making processes, whether on the clinical application or the financial, the business, partnerships, and so on and so forth. We're seeing increasing need to optimize workflows, job descriptions, and technology deployments to maximize the efficiencies and help reduce the shortage of caregivers and the crisis that we have. So in addition to measuring adoption, we quickly also realized that we had to develop more guidance, more hands-on and hand-holding for aging service providers. So over the past few years, we developed several hands-on tools for our members. So let's quickly take a look at some of those tools. First, we realized that while many of our members are conduct strategic planning and update their strategic plans every few years, their strategic plans were quite thin when it comes to technology. And many of them did not have a strategic IT plan that is congruent with their strategic plan. So we have developed a strategic IT planning workbook that encourages members to ingrain technology into their strategic planning from the get-go, and to, even if they haven't done so initially, to take a fresh look at their strategic plans and each one of the strategic goals, identify the key enabling technologies that could help them achieve those goals more effectively, more efficiently, or accelerate achieving those goals, and then conduct a strategic IT planning, creating a strategic IT plan to first update and upgrade their infrastructure, take advantage of any major initiative, whether it's a new campus build or an expansion project or an update project, acquisition of new business units, and so on and so forth, to again prepare that infrastructure for whatever IT applications they need to layer on top of it down the road. We then started developing hands-on tools to help our members better understand, plan for, and more importantly, select the most appropriate technology application that is commercially available on the market that fits their business model, their care setting, the population that they're serving, all the needs that they have identified through their planning process as must-have functionalities and features, and then shows them how to go about soliciting bids and implementing the technology. We started with the EHR selection tool back in 2012, and then we followed it with 8 more selection tools. Telehealth and remote patient monitoring was the second. Medication management followed, functional assessment and activity monitoring, shared care planning and care coordination, social connectedness and engagement technologies. The last 3 included safety technologies, how to select a health information exchange entity or network depending on the location of the care provider, and finally, earlier in 2021, we released the data analytics selection tool. Each one of those tools has a comprehensive white paper explaining the technology, as I mentioned, reviewing the evidence of efficacy and cost effectiveness, reviewing the available business models, reimbursement streams, or subsidies. Again, in the US, these are focused on the US, but then also how to ascribe and calculate ROI, and we have a link to an ROI calculation tool that can be used by anyone. And then we walk them through the planning process, how to pull together a planning team, how to identify functionalities and features that they really need, including integration capabilities, for example. And then there is an interactive guide to walk them quickly through the white paper. There are case studies from providers, written by providers for providers, and we insist in those case studies on sharing not only the positive impacts, but also the challenges and how they overcame the challenges, the lessons they've learned, and the advice that they may have for other providers who are thinking about embarking on the same journey. Other resources that we have developed to help our members include a white paper on cybersecurity, which the threat thereof is increasing, which also includes a self-benchmarking questionnaire to help our members better sort of assess their cybersecurity positioning. We also developed the more technologies that we deploy, especially those that are resident or client-facing, the more technical support and training those residents need. So we developed an interactive guide to help our members better understand the available business models and modalities that they can utilize to deliver such services. Finally, you heard me mention the case studies, and over the past few years, we have collected over 110 case studies that are written by providers, and I would encourage you to take a look at those. In 2020, we also contributed 2 quick casts to help our members embrace social connectedness and engagement technologies, as well as telehealth, two of the most popular technology categories. We also participated and contributed to a technology chapter in the LeadingAge pandemic playbook. Now I will give you a quick demo of one of the CAST tools so that you can see how it works. To get to our tools, you go to leadingage.org, and from there on the top navigation panel under Centers, you click on Center for Aging Services Technologies, which is the second one. It takes you to the CAST pages on the LeadingAge website with all the resources that we talked about. If you click on the technology selection tools, it will take you to the page where the 9 tools that I mentioned already are there. Let's, for example, take a look at the social connectedness. You will see here, these are the 5 components of the initiative, the white paper. If I click on that, it will show you the table of content for the white paper, and this is very comprehensive. If I click on the interactive guide, which, by the way, you need to be logged into, you have a My LeadingAge account and log in. As you can see, I'm logged in already here. It says, hello, Majd. Or it may ask you to fill a registration form with a valid email address. So again, this is a yes/no type question-driven guide to give you a quick overview of the white paper. Do you know the different types of social connectedness engagement technologies available? If you say no, it will give you a quick definition summary, and there's a hyperlink that can take you directly to that section within the white paper. If we go back here and look at the selection tool, again, there are several sort of check boxes. You first select the care setting. So for example, I want a system for life plan communities or CCRCs. You can select the social, so the type of engagement, whether you want to connect the user to peers, to family, to professionals, facilitator mediated, what kind of social connectedness modality you want, what kind of engagement modality you want, and whether what embodiment do you want this to be, on a tablet, on a smartphone, on a wearable, even robotic, whether it's for a single user or multi-user, the kinds of prompts and controls, whether it's touch screen, voice control, visual prompts, eye gaze control, and whether you need accessibility support features like for hearing, vision, and dexterity, what program support you need from the vendor, and what type of support services you need, and so on and so forth. And if you click View Products, it will give you a list of all the technologies that are listed. You can learn more about each one. If one has a case study, you will be able to view that case study by clicking on it if the vendor contributed a case study. And again, you can go back and look at the details of each one of those products in the matrix, either from the very end here, or by clicking here on the matrix. And I have to warn you, the matrix is overwhelming because it has hundreds of yes/no questions ranging from the business line applicability all the way to the front-end user interface, to the types of alerts, to even the company's experience, how long they've been in business, how many clients they have, and the strength and areas of improvement that the company have identified. So I hope you find these tools useful, and I look forward to seeing you use these and put them to action. So for the audience, if you're a provider, you can use the tools and resources that we have developed, which are in the public domain and are free for anyone. And I believe that they could be useful to international audience, especially that many of the technologies that we feature may be available in your markets. You can participate in education opportunities and events from LeadingAge and CAST, and we are also part of the Global Aging Network that I would encourage you to explore participating in. For associations, I would highly encourage you to join the Global Aging Network. And I believe there's an opportunity, if you do engage there, to engage with CAST and potentially license some of the tools and invest in localizing the tools for your regions. And we're very open to negotiating and discussing those aspects. You can participate, for the vendors, they can participate in the CAST tools, can contribute provider case studies, which are, again, participation and the case study are free. You can consider exhibiting at LeadingAge, CAST, or the Global Aging Network events. And you can potentially join, as we would love to have you as business partners. With that, I would like to thank you for the opportunity. I look forward to the audience questions and the discussion. And finally, you have my email address here, and I look forward to hearing from you if you wanted to reach out afterwards. Thank you.
Actually, I have some questions from our audience on the internet. Hello, Dr. Alwan.
Hi, how are
Good
you?
day to you. I'm good, thank you. And you?
Good. Thank you.
Well, thank you for giving us so much information, and it is really, really encouraging. And now we have questions here from the audience on the internet. Here they say, well, in your experience, what are the major challenges for the aging services? and care providing industry to adopt technologies? And how would those challenges be tackled? Dr. Alwan?
Sure. There are several challenges. The first one, the biggest one, is the expectation of reimbursement and the payment model, or the lack of business model. So that's the one. The second one, there are technologies. We've seen a lot of technologies that have been designed by engineers that are solutions in search of a problem. In other words, they did not use a user-centered design approach. They did not try to work with providers to better understand the problems and design specifically for the providers, with participation from caregivers and older adults and so on and so forth. So that's another challenge. A third challenge is, again, is around the lack of expertise among some aging service providers, certainly in the US, especially in the early days, in terms of knowing how to go about planning thoroughly and preparing to introduce technology into their communities and organizations.
Yes, I think, we have quite some similar issues here as well. Now, another question that we have here is, how would you see possible changes in the workforce of care providing industry resulted from the extensive application of technology?
Well, the possible changes could mean, again, retooling or retraining some of the staff to focus more on the aspects of care that require hands-on and a human touch, and maximizing the efficiencies of the workforce by automating the vast majority of the mundane tasks, by introducing robotics where possible. For example, one of the examples that we're seeing here in the US, and you probably will hear from one of my colleagues who's participating in the summit, they've deployed robots to deliver meals in the dining hall between the kitchen and the dining tables in aging services communities, rather than using human sort of servers, right? And that was a very cost-effective solution, and helped sort of overcome the shortage of caregivers or staff.
Yeah, I think, yes, we are beginning to see more robots around here as well. So this is a very, good sign, and it's a very encouraging for our staff as well. So I think, we have running kind of out of time now, and thank you so much, Dr. Alwan, for your answers. And then we will be in touch, and definitely we will be visiting your website very soon.
Absolutely. I'm happy to answer any questions for those who would like to send me an email. Thank you so much.
Question. Oh, sorry, Dr. Alwan, we have one question from the floor.
Hi.
Sure.
Hi, Dr. Alwan. I'm Hai Wei. I'm from the Hong Kong Council of Social Service. Well, because in the floor, we have the Director of Social Welfare here. So I would like to ask the role of the governments, whether it's federal government, state, or city governments. What are the roles of the government in the promotion of the adoption of technology in what you have said? Is it really through the reimbursement mechanism or any other policies or so on? Yeah, can you explain? Thank you.
Absolutely. There are several roles that governments can play. Number one, getting out of the way, right? giving providers the
waivers or allowing them to at least experiment and explore innovation. Sometimes regulations, for example, having a certain number of caregivers per resident, right, in senior living communities, could be a sort of a barrier to exploring with innovative solutions that could potentially lead to reducing those ratios, right? So maybe number one, flexibility in terms of, especially during research and evaluation projects. And number two, again, potentially sponsoring demonstration projects that could lead to changes in the reimbursement. Again, I know that governments are usually very cautious and do not want to encourage, open the floodgates and open the door for fraud, right? But again, I would say demonstrations and flexibility in terms of regulations could be the way to meet those concerns while not stifling innovation.
Thank you, Dr. Alwan. And thank you very much for your time. And I think, it's time to say goodbye for now. And then we'll surely be in touch and visiting your website. Thank you, Dr. Alwan.
Thank you for the opportunity. Bye-bye.